stop it. It'll be one or the other and putting all this stuff together. And you're not gonna know till you come in.
Oh, you said you were nice.
I'm not nice. Do you guys want to see like a basic setup again? So that you familiarize us and I do it? Huh? Want me to do it? All right.
I'm tired of it.
Okay.
It's up to the class.
Probably better to pretend that I'm coming this way. I'm gonna put a mask on so it looks authentic. I'm gonna open a couple towels, maybe just one. And Rachel, you'll get to see instruments you haven't seen yet. I'm just gonna go get a mask. Okay. You're going to throw it off. You're using the outer guard, right? You're going to pick up this gown so that you pick it up like this, right? Instead of dragging it across. And then you let it down. Hands across the neck. And then you can fold your hands in. Put them on the right side. Somebody doing that? You can bring it to the edge. What are you looking at?
We're just making sure.
Okay, so you can bring it like almost to the end, put it there, flip it over.
I saw your pinky.
You see it? As long as it's not the middle finger, you're good.
That's got it.
Okay, and then remember to turn. Important. Keep a hold of it. Don't let it go. Make sure it doesn't stick out the end, because if they go to grab it, they're going to contaminate it. So just plant your feet at your sterile table when you go to turn, so don't flip around. You'll see the little surgeons do a little spinny thing a lot.
The little surgeon.
All right. So, I'm going to do this. I'm going to make sure there's no holes in my table. I double glove. If I did do this and there was a hole, I can flip off my glove, right? And then hand this off. And then they would just open another one. Okay? So, now I can do this first so that I can move all that stuff off my table, right? You don't want to hit this, right? So you want to make sure that it goes down. This is sterile, so I can step up. If it didn't have anything on it, just a reminder, then this is not sterile, okay? That's when you would make sure you bring it to you first and then move forward and put it back. So you guys know all this. You guys remember all this, right? All right. So now I can take my whole thing. I can move it over. Okay? I can move this over. And then my circulator would take this for me because I have to drape it. So if you could grab that, just pull it off. All right. So this is going to go here. It's going to go here. I'm going to put this here. Here for my circulator. Okay? Now you've still got your whole table all open, right? So I need, because it's a full setup, I need one for the bottom. I need 2 more for a roll, because it's a large roll. I may surprise you and just have you set up a minor.
Yeah.
You never know. You just never know. Okay, and then roll. Nice tight roll. Right, and don't do this.
Why not?
Will we lose points if we do?
Speed's a little important, but you can see that that would take you twice as long, right?
Right.
All right. So, now of course I don't want to touch any of this stuff, so I'm going to move it with my foot, and you do a lot of things with your feet. You're a scrub nurse. Right? Okay, so I'm going to take this. I see that there's an indicator, so I'm going to pick this up. I'm going to see that I'm pretty far away. I'm not touching anything. I'm going to bring it over. These are really hard. Fun stuff.
These aren't the ones that we learned last week?
They are.
Or 2 weeks ago? Oh, yeah, they are.
Yeah. So you're gonna have 1 tooth on one side. Yes. 2. There. Okay, and I'm going to throw this off because we're not counting that. Now the indicator, where is it? Oh, there it is.
It's not fair.
A lot of instruments.
Is there a reason why you put it on the top of that one?
Well, I actually probably should have put the small one out first, but it doesn't matter. As long as you're either one. Yeah.
We don't have to know them for the test.
What do you have to not know?
These new instruments.
You might. What if I do a major and minor vascular? Because you're going to count, right?
He wouldn't dare.
Oh, you know how evil I am.
Just got it.
I'm evil. All right.
Whoever rolled those things.
Well, you didn't see this stuff last week, did you?
No.
Oh, may the force be with you.
Go to the nearest library and get
They're
that
called
book.
Wheatlanders.
Woo!
What'd you say?
Nice. Wheatlanders.
Wheatlanders.
Yep.
They look like mini rib spreaders.
Yeah. You're right. They do.
Where's the nerve hook? There you go. Okay, just check.
Penfold. Penfield.
Nice.
Oh, what's that? What's that?
God, I'm so proud. Holy proud. You guys don't need this. I don't
That's
need to
full
teach you.
section.
You guys know it all. You know it all. You don't need it.
Let's just do our final exam tonight, then we can get our placement over
And
the
just get it done, right? All right, and this can go back. So I don't care which one you take out, like first. Probably because we have more small stuff. I probably should have done it the other way around, done the small one, and then, yeah, the small one, and then just sorted my small stuff, because there's only actually a few big instruments to go in here, but it still worked out fine, right? All right, so now I'm gonna drape my mayo. And you guys remember how to do this? Okay, so make a little pocket. And then if you stand a little bit to the side, you can actually grab a hold of the end and just twist it. Okay? tuck it in. And then this can go right on top. Okay? So now, I'm gonna take my stuff and try to sort it into my other stuff, okay? So I've got scissors and needle drivers, so I'm gonna put it between my scissors and needle drivers. Okay. I've got, these are, they look like snaps. They're cookers, but they're pretty tiny. They go between the Kellys and the snaps. And then the Kellys go here, Leahy's go here, and then my sponge sticks go here. Okay. These are these are hemoclippers. So eventually we'll have water in there. So I put mine here, and I put these here. Okay. So,
Sorry, do you load those before you put them in?
no, I actually put them in while I'm doing it, and then once we have counted, then I load them all. Yeah.
So before the surgery starts,
Yeah.
you've loaded them.
All of them, yeah. So what I find the easiest with something with big instruments like this is I just snap these closed and turn them this way instead of being on my string. Okay. Okay.
I know, that's what
What's that?
you ingrained that everything was supposed to be open in our brains, and now you're telling us to close shit. How are we supposed to know the difference?
Oh, open when we're putting stuff away, right? Open when I'm putting stuff away, because when you're handing, it's closed. When you're handing them up, or you'd be doing this. Your doctor. All right. And then this is iliacs. So I'm going to close them, and I'm going to turn them this way. I just find they sit better. And like I say, chronoes, their setup could be different, right? But it kind of the scenario is kind of the same,
Sure.
right?
What were the smaller ones that you closed and turned around?
The
What were they
bakies.
called? Oh, yeah.
Sorry?
Debakis. Yeah, corrotation.
Rotation.
Corrotation.
And that big S one is called,
This one? That's this one.
that's that one, yeah.
This one's a SEM. S-E-M-B.
It looks like an S and a B. I don't see it this time. I saw it 2 years ago. I don't see it now.
Okay. So then I can bring over some of my stuff, right, that eventually I'm going to have loaded. Has to go onto my main table, right? This. And you can see, like, I've got my instruments all set up. Now I can start unloading this stuff here, right? This here would be for an Omni. So we would have another table that we would drape and we would pull out an Omni, and that's the one that I asked you guys to look at.
That big retractor.
Big retractor, yeah. I'm gonna need my sharp. Some people use these, I like them, so I put them here. My bag. And this is an ioband, and this can go. So basically, I'm set up for an aorta right now, basically. Okay?
Why
So-
is there a little cup in there?
This little cup. So, what we do is we put, not for an aorta, but for the one where I'm saying that you take the vein out of the arm and you dilate it and make it bigger and you put it down into the leg. What they do is they put methylene blue in here, right? They pull out that vein, they'll stretch it out, and then they will trace a blue line all the way down because they don't want it twisted when they go to put it in. So if they see the methylene blue, they want it all straight up, so they'll have it like go down They'll
Okay.
sew it in and then they'll make sure it's straight, because you don't want it to twist. Because they don't actually, sometimes they don't cut all the way down to put it in. They just feed it underneath with a sponge stick.
That's for the varicose vein?
No, that's for somebody that's lost some circulation in their leg, right? And they've if the vein is gone, so they can take, like, they could salvage a vein out of the arm and put it in the leg to pink up the foot so that they don't lose their foot, basically. So this is for methylene blue. That's what that's for. Not in an aorta though. So aorta. So then I would open up my pack and I'd be ready to count. Okay. So counting. If we have a count sheet, I'd like to get a count sheet so that somebody can guess that. Let's see that.
She makes it look so easy.
Big time.
I'm screwed.
What's on the blue?
Actually take a Blaylock and put it on the other end. It just weighs it down and pushes it out of the way.
What's it attached to?
It's attached to the suture.
No needle drivers, no nothing?
No, like they'll have a needle
It's a
driver
little
on the
clip.
one end,
Oh, okay.
and on the other end, they'll just put a Blaylock to kind of hold it down. They'll sew and they'll get to a certain spot and they'll take that Blaylock and they'll put it on that one and then transfer it and switch it to the other side. Okay?
Oh.
Didn't I just take my, yes. Somebody be a circulator for a sec. Okay, so right there is the large sponges. So I really want you guys to see this, okay? So basically, we're gonna count large bunches, okay? So I'm gonna go 1, 2, 3, 4, 5, and then you're gonna write 5 in that very first block. 5. Then I'm going to count it back. 1, 2, 3, 4, and 5. So there's 1. So then I'm going to do the other one. So I'm going to go 1, 2, 3, 4, and 5. Then I'm going to go 1, 2, 3, 4, and 5. So you're going to put 5 beside it. Okay? And then you're going to move down, and we're going to have, well, normally we would have like a blade, which we don't have. Oh, it's probably in here. No? I would have thought there'd be a blade in here.
Over there?
No. Okay. So normally, let's say we would have a blade. So you would look down that row and you'd see blade, and you're going to write 1 for a blade.
Oh, it's on their side.
Yep.
Sure. There you go.
Yep, blade. Right? And then you're going to have 1 turkey-based syringe. Just 1. Okay? And then we would have a Bovie. Right? We would have a Bovie tip because they're definitely going to use cautery. So then you would put 1 for Bovie tip.
That's next on the list.
Okay? Then you would put, we have a pen, we have a cap, and we have a ruler. So there's 2 pieces to our pen, and there's 1 to our ruler. Okay? So you would put 2 to the pieces to the pen and 1 ruler. Yeah. Okay? And then we have 1 extra thing that's on our set, and it's 3 hemoclips. So you look for that, and you put 3. Okay? So now what you're going to do is you're going to flip the page over. Okay? And we're going to count everything. So you're going to start with scalpels, which should be right at the front. So we're going to go 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. So there's 5 scalpels.
Does the circulator
She does. Usually she repeats it after me. When people first start in the OR as a scrub nurse, I don't have them lead the count because it's too hard because you don't know what's on your count sheet yet. So I allow the circulator to lead the count, right? Which is fine. So as long as one of them, to me, as long as one leads the count, right? I find personally, to me, circulators that count with me, I hate that. Right? Because how can you concentrate if you're counting? It's kind of like when you're taking a picture or you're taking a video of your kid in a assembly, right? You're really not watching the kid. You're like trying to focus on the, right? So I find personally, and never mind. Anyway, okay.
Shut your mouth. One more
I'll
time.
just shut my mouth and I'll keep going. Okay, so one towel clip, one. And what you would do as a circulator is you're going to be standing right there so that you can see my instruments. And you can see me counting with my instruments, okay? So then I'm going to go scissors. 1, 2, 3, 4, 5, 6, 7, 8 scissors. Okay? Needle drivers. 1, 2, 3, 4, 5, 6, 7, 8, and 9 needle drivers. Okay? Snaps. There's one in my hand. 2, 3, 4, 5, 6, 7, 8, 9, 10 snaps. Cokers. 1, 2, 3, 4, 5. Kellys. 1, 2, 3, 4. Leahys. 1, 2, 3, 4, 5, and 6. 6 Leahys. Mosquitoes. 1, 2, 3, 4, 5. Okay. Sponge sticks. 1, 2, 3, 4, 5, 6, and 7. Okay. Now you're going to go to vascular. You'll see there's like big, so go down to vascular. You'll see it on the sheet. So my first thing is going to be 2 pots. Okay? Pots. And then I'm going to have 2 coolies. 2 coolies. Right? Then I'm going to have 3 debakis. 1, 2, 3. Okay? Then I have, these are the ones with the Fogarty pads, remember?
Yeah.
So these are Fogarty's. 1, 2.
We even played them on the radio.
Yeah, that's right. Iliacs. 1, 2, 3, and 4. Iliacs. Okay. Satinsky. 1, 2. Corrotation, we have 1, 2, 3. Sem, we have 1.
Uh-oh.
And that would be contaminated, like I would have to get rid of that, right?
So then,
You keep it count.
It has to stay in the room because we've counted it.
Oh, okay.
So they would just put it onto that stand over there and they'd leave it there, right? And now being in vascular, you know, you have to say to yourself, well, I need that. Well, we do have 2 left. We have a big one and another one, right? So we should be all right, right? If we lost the big one, right, and there was a big guy coming in, then I would ask them to call for another one for sure. Because there's a chance that we're going to need this big one, and they're going to need it quick, and I'm not going to have it on my table. So I would call for it, okay?
And would you start the case before that instrument came, or would you wait until SPD came up? What would the surgeon do? Or what would you say?
Probably by the time they open, they do the cautery, everything, it'll be in the room.
Okay.
Yeah, so I would
So
be
then how
okay
do
to
you
go
add
ahead.
it to the count once it comes in?
Basically, what we would do is they would open the tray, right? I would take the stringer out. I would pull one other corrotation out of that tray, and I would put it on my table, and they would count it as 1.
in the ad column line?
Yeah, in the ad column, so the next column over. So that's what they would do. Yeah. Okay, so we still got Blaylocks. So they're 1, 2, 3, 4, 5, 6, 7, 8. They'd be in the vascular, pretty sure. Oh, you know what? They're on the other side. They're on. They for some reason they have it on the Blaylocks. They have it on the small. Yeah. There's 1, 2, 3, 4, 5, 6, 7, 8. Okay, 8.
Takes a bit of time, eh?
Yeah, it does. Okay, so then I have Penfield.
I'm sorry.
Penfield. Okay, I have a nerve hook. I have a compression clamp. Okay, so now these hemoclippers won't be in the vascular, they'll be in a different section, so you have to find them. Yep, so there's 1, 2, 3, 4, 5, 6, 7. Okay, and then we would do suction, so there'd be 1, 2, and there's a third one.
Yeah, the anchor is under the.
Right here. Three pieces, because this comes apart. Okay, so that'd be 3. And then tissues would be next. And we'd go 1, 2, 3, 4, 5, 6, 7, 8, 9.
So you don't separate them non-tooth and tooth?
Nope, they're counted all as, yep,
Tissue.
yep.
Sorry.
And then retractors are counted all together as well. So there's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, and 17. There's 17 retractors. Okay? So that's how we would do a count. And then what I do, usually we have communication between us, and I would kind of take my hand, I'd like kind of go through here and look, make sure that I've kind of picked up and got everything on my table, right? Kind of like I know, oh, I didn't. So I'm going to say to you, I missed some instruments. Okay? So basically, I won't even set it on my table because I've found these instruments. So I'm going to add, I want you to add to the count. 1, 2, and 3 scissors. 1, 2, 3. Okay. And those are pots. And we're going to add 1, 2, 3, 4 retractors. Okay. So now I'm going to make sure that I got everything. Okay. Make sure there's nothing here. I just stepped on the instrument.
Did you count those little tiny weird things that hang over the edge? Under that blue towel? Is that what you're saying?
This one?
Yeah.
Yeah.
But that's just counted as a retractor?
Yeah.
Okay.
It's a little spring retractor.
Right.
That's all that is. Okay? So that's how we would count in. Okay? So let's say we're down to the end. Let's say that this is on the floor. Okay? This is on the floor. It's our bucket for our sponges. So we're at the end of the aorta. They're starting to close, right? We need to count sponges right away because we want to make sure that they're not going to count any sponges in. So what I'm going to do is I'm going to pretend that we have 3 on the patient, in the patient, or on the patient, and we have 3 in our bucket. Okay, the bucket's down on the floor. So the circulator would make sure that she goes into that bucket and she pulls out with her gloves. She pulls out these and kind of drapes them along so that we see them. So when we're counting from 3 different spots, right, it's very easy to make a mistake. So what you've got to do is you've got to do a flow, right? Either from the patient to your table to here, or from here to the table to the patient, right? And you continue. So, and I'll show you the reason why. And I know I've gone over this, but it's been a while. And you guys are going to start counting once you get into your placement, okay? So you're going to go 1, 2, 3, 4, and 5. Then you're going to go 1, 2, and then spread those out. 3, 4, and 5. Okay? Then you're going to count back 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Now the reason why we do the continuous count, and if you understand this, you'll know why, is because if I went like this, if I went 1, 2, 3, 4, 5, and then I went 1, 2, 3, 4, 5, I don't know where I ended here. So let's say I said, oh, I ended here. So 1, 2, 3, 4, 5, 6. That's wrong, right? But if you're talking 30 sponges, right, then you're all of a sudden looking for 4 sponges, right? So that's why we continue. That's why it's a continuous thing. all the way across, right? For that specific reason. Because you can make a mistake because you don't know where you ended. Does everybody get that? Understand that? Yeah. Makes sense, right?
Yeah.
Okay. So that's how we would count out, right? And we would tell the surgeon, okay, all your sponges are out. Because that's the biggest thing. Because some of them, when you're doing an aorta, are so soaked in blood, right? They can get like wrapped underneath a bowel easy, very easy, right? And you say, we're missing a sponge. Really? They start like searching and they find it and pull it out, right? That's why right away, as soon as they're starting to close, we do a sponge count right away. In my mind as a scrub nurse, and it takes time to do this, I kind of always know where the sponges are. So I kind of always know that, okay, there's 2 in, right? Still 2 in. But sometimes things are going so fast you can't keep track. You just can't, right? And like I said to you before, is if we ever came in an emergency aorta, we don't count, right? We're just cutting the patient, we're stopping that bleeding, right? We've got 50 sponges, like between start to finish, right? I have my circulator, she's constantly, even though we didn't count, she's still constantly counting off 5, because chances are we're gonna be in multiples of 5, right? So at the very end of the case, let's say she's counted off 39 sponges. I know, right, that there's either going to be 11, there might be 16, right, left. So I'm going to count and see how many there are, and let's say we come up with 13. Well, then I know that I'm missing 3, right? So I'm going to get him to take it out. We're still going to x-ray the patient, no matter what, because we did not count. We're going to x-ray the patient. But the last thing I really want is this person's been through so much, they're closing up, and there's a sponge in there. So all you have to do is try to do multiples of 5, right? So that you kind of, in your mind, you're pretty sure that the sponges are out. But either way, they're going to do an x-ray. But if we don't do multiples of 5, and we just say, well, we'll forget it, and we just clump all our sponges together and not worry about it, well, he closes, there's a sponge inside, we have to open, we have to take them out, right? So that's why, either way, I would just do multiples of 5 and not worry about it. Okay? So then at the end, the one thing about it, one thing that I would say, being a scrub nurse, taking this mask off now, being a scrub nurse is you have to keep order of your table at all times, because basically the patient is open from here to here. That doesn't take that long to close. You saw how fast we actually count. It's not that fast, really. You've got to count everything, right? So you've got to, your best thing to do always when you're scrub nurse is put things back exactly where they came from. Always. Because if you have you have like 3 snaps here and you have a couple of things there, then you've got instruments all over the place, and your count, they're going to be close, they're going to be stapling, and you still haven't even finished your count yet, right? So you got to try to really, really, really be organized. That is so important, right? Once it's used, you put it back, right? If you're using, which we would be using a Mayo stand, okay? So on my Mayo stand, with an aorta, I would put my scalpel up. Of course, I'd have a thing in there. I'd have my scalpel up. I'd have suture scissors for sure, because you know that you're going to use suture scissors. So those are suture scissors. Okay. Nice, heavy, like when you're talking aorta, it's a heavy thing to cut. So I'd have nice, heavy curved scissors. These are for sutures. This is for tissue, heavy tissue, right? And the mets are for a lighter tissue, right? You can see the difference, right? We're just kind of reviewing. I know you guys have learned all this, but we're reviewing, okay? So I would have my heavy up, right? I would have a Kelly up to hold my suction and stuff, for sure. I would have that. I would have, if it's a smaller patient, I would probably have a corrotation clamp up, I would probably have 2 iliacs, because like I was saying to you with an aorta, right? They're going to clamp off at the top of the aorta, and they're going to clamp off 2 iliacs at the bottom, right? That's what they're going to do. Either that, or if the bleeding's really bad, they're going to clamp on either side of the aorta, okay? But they still would probably either use an iliac or another corrotation, right? So, and then I would start out with maybe just a pair of short tissues, just to get started. But immediately, once they're in, I would switch right away to a nice long debaki, which is delicate, right? So I would have that. I would start off with, for a retractor, I would probably start off with just 4-prong, so that they could just hold the tissue back and they can dissect, right? And that's basically all I would have on my table. I would put my sponges up here. I'd have 3. I'd have my cautery, I'd have my suction, and then all I have to do is push that up, and it's going up and over the patient, right? They can like get the suction up, they can get the cautery up, they can clamp it with the Kelly because it's on here, they can pull the sponges up, they have a knife, right? And at that time, I'm kind of bringing my table in, right? So I have this kind of all ready for them to kind of get started, because if we're in an emergency, they need to just get started, right? I would have like my light handles on there too, right? It's my suction on there too, right? Not with that on it, but with the suction just on it. You what?
You need a bigger table.
No. So, you know, basically, I would slide this up and over the patient, and then they would go click to the light handles. They would get the suction up, they would get the, you know, and then they'd use a Kelly to hold it so it doesn't fall off, right? And then they would cut, right? Now with an aorta, you would always have, that's just, it's just common knowledge, at least here, for all of our vascular surgeons, you have silk ties, or silk sutures. So that as soon as they get in, and I was telling you about the aorta, they cut the aorta open, and when they open that aorta, they'll clamp it first, of course, and they'll just bleed out. So they're going to clamp it, right? Once they do that, that's when they're going to use that heavy scissors, and they're going to cut it, right? And it's like a jelly, solid jelly that's in there, solid, right? But once they move that out, so I would like put this up for them to like put it in, right? Once they move that up, there's going to be little bleeders underneath at the very bottom of that aorta, and that's when you need your silks. They'll need the silks right away, right? They got to stop that bleeding. So they're going to silk, they're going to cut it, and then I'm going to load up another silk. I'm going to keep on loading silks until the bleeding stops. So I'm constantly, I usually have 3 silks on my table right from the very beginning. As soon as I use one, I call for one, right? With an aorta, right? And so this is just one but this is one emergency that if you kind of get to understand what they're trying to accomplish, you will find that you'll be able to do it, right? It's surprising how
They're all kind of the same.
they're done pretty well the same, yeah. The only difference is sometimes when they're sewing in the graft, they use different instruments to sew, like needle holders or whatever, their preference. By then it's controlled, right? But as far as, you know, like I said, I have never seen a compression clamp used. But what it is they can't get that. See, the thing is if you open a belly up and you cannot see because they're bleeding and bleeding and bleeding and bleeding, you got to stop that bleeding, get the clotting blood out so that you can see what you can do, right? So sometimes, supposedly, and I've never seen it used, not in my time anyway yet, they just push down on the aorta, right? Just to try to get some control, right? They'll push down and that just clamps it off enough for them to kind of see what they're doing and try to get the blood out, right? In aortas, we have what's called Cell Saver. I mentioned it last week, where we recycle their own blood, which is really cool. So that we can just constantly give them their own blood back, right?
Is that new? Something new?
No, we've had it for a long time. So my suction, actually, I get a different type of suction. and one end goes to the person that's looking after the cell saver, right? And so every time they use that suction, it goes up into her, and she's got a little machine, and it cycles the blood, and then they just make a bag, and they give the person the blood back.